This second activity is all about you. It works at an individual level. And the challenge is for you to develop a priority list for health promotion for yourself and act upon it. So basically, it involves a little bit of detective work and a little bit of epidemiology. And that is, you need to cast your search or your mind back to the generation of your grandparents and identify what health issues they may have had. Now, sadly, some of them may have passed away from certain illnesses, disease, or whatever. Um, so you need to actually find out what types of illnesses afflicted them. So, for example, if we know that there may have been coronary heart disease in one or more of your grandparents, especially the males, are particularly susceptible to this. And this may have also manifested itself in some of your uncles who are related to this particular grandfather. So you might have, say, coronary heart disease, whether it's a heart attack or whether it's atherosclerosis identified, which would mean whether you're male or female, but probably more if you're a male, that you might then identify that coronary heart disease is a particular issue in your family. So the idea is to go through 2 generations of your family to see what the risks are. Now, if those 2 generations are healthy, then you might need to go back to your great-grandparents to identify what diseases and illnesses may have been prevalent at that time. So that's the first part of the exercise. Once you've done that, so you start out with the disease, identify the major diseases that your family seems to be susceptible to, and from there you work out what the determinants of those diseases are. So if we think about, again, this example of coronary heart disease, well, the major etiological factors for coronary heart disease are smoking, diet, and physical activity. And so they give you clues as to what you might do to change your risk factor. There might be another one, body weight. So body weight. So once you've identified the determinants, then you can identify 3 behaviors that you could adopt during the conduct of your general life to act upon. So these could involve primary determinants. So again, if we take the issue of coronary heart disease, I've already spoken about those 3 or 4 determinants, so diet, physical activity, smoking, of course, and body weight, BMI, body mass index. So those are the determinants you might look at. But there's also another way to look at this. You can actually opt for early detection. So you might go and have, say, a cholesterol test done. So cholesterol test done to see if you're within the normal range or if you have an elevated cholesterol level. If you're a little bit older, you might go and have an angiogram done. Angiogram, which is one way to find out how healthy your arteries are to detect early atherosclerosis. But in any case, you need to develop a plan. So if, for example, you wanted to change your diet, you might know that saturated fat is a risk factor for coronary heart disease, so you might identify the sources of saturated fat in your diet and then determine how you might lower the content of saturated fat in your diet. Or you might smoke, and so you might enroll yourself in a quit smoking campaign, quit smoking program to reduce your risk. Now, the last point that I want to make about this is that often, as health practitioners, we're trying to decrease risk in our patients, but we often don't realize how difficult that can be. So the exercise is doubly important because it actually gives you insight into the difficulties and barriers to preventing illness or disease. Now, I assume most of you are reasonably young adults, fit adults, and the young fit adults tend to have this idea that they're invincible, and so it's a particularly difficult age group to actually implement any health risk change in. But in terms of your own exercise, good luck with that, and the benefits are substantial. So here's one I prepared earlier. Now assume, for example, just a fictitious example here where I've got, say, my father may have developed cancer, and he died at 55, say. My mother developed cancer. She died at 75. So it may be that you need to work out the types of cancer, but in general, say for example that this one was a skin cancer and it was, say, a melanoma, and this one was a digestive system cancer. Okay, that gives us an idea of the risk factor. So the risk factor is cancer. We then need to look at what the determinants are. So the determinants the modifiable determinants are for the digestive system cancer could be fiber intake, especially vegetables and fruits. The determinants for the skin cancer might be sun exposure. There's one further element to this, and that is early detection. So, for skin, that might be going to a dermatologist to check out all your moles. Just to check out all your moles, and it might involve having a colonoscopy, as unpleasant as that sounds. So, and in fact, it's recommended for everybody over 50, once they turn 50, especially males, and especially if you have a history of digestive tract cancers, to have a colonoscopy. So, my plan might then be, number one, to modify my diet to make sure that I have, say, 5 serves of vegetables per day. Secondly, to make an appointment with the dermatologist. 3, to book myself in for a colonoscopy once I turn 50. Now, what you might do then is move from there to working out how you're actually going to modify your diet. So you might have a weekly diet plan to incorporate 5 serves of vegetables per day. So that's the exercise in a nutshell, and really the intention is to introduce you to this idea that you can change the course of risk for ill health